I'm Peter Roper. Welcome to Potluck Politics. Today we're going to have an update on healthcare. We're very fortunate to have our Congressman from the 2nd Congressional District, Joe Courtney. Thank you very much for coming, Joe.
Hi, Peter.
Appreciate
Good to be
time.
back. It's been a while.
And we're looking forward to your knowledge as well
Sure.
as your time. There's a lot of talk about these days. We got a lot to talk about, but we're going to talk about healthcare because it's still a hot issue, unsurprisingly, because the Republicans can't seem to let it go. The enrollment period for the Affordable Care Act is actually happening right now. People seem to be signing up in record numbers. What does that tell us about the need for healthcare in this country, despite what the Republicans say?
So, well, what it tells us is that, despite all the, horrible narrative over the last 6 or 7 years since President Obama signed it into law in March of 2010, the fact of the matter is that the country made great strides in terms of, creating insurance for people. In our district, Eastern Connecticut 2nd District, the uninsured rate was about 9% when the law passed, and up until I think the last figures from census, it's down about 3%. We actually have the lowest uninsured rate of the 5 congressional districts in the state of Connecticut, and that happened, because there was a lot of hard work. The libraries, helped with enrollment, the community health centers, senior centers, as well as hospitals, that really kind of steered people into enrollment. And as I think common sense would tell you, it's not any great intellectual leap to understand that when people have an opportunity to have an affordable coverage, that they actually will use it, because it's one of the universal needs that all of us have, that at some point, we're going to need health care. And so it's unfortunate that we have been sort of stuck in this existential battle down in Washington, starting in January when Speaker Ryan was sworn in as Speaker and vowed to repeal it within 30 days. And then President Trump, in his inaugural speech, came out of the chute saying that was going to be #1 priority. I mean, an interesting thing happened on the way to that, which is that the external pressure of millions of Americans, came, thundering into Washington, and as we know, at the dramatic vote last summer where John McCain gave the thumbs down in the well of the Senate about 2:00 in the morning, and it really, if you look at it, I mean, from the March of Dimes to the nursing home industries and everyone in between, really rose up in total unanimity in opposition to repealing. One of my favorite little sort of factoids is that Planned Parenthood and the U.S. Conference of Catholic Bishops were on the same side in terms of the repeal effort, which normally they're, totally
the list of supporters was pretty amazing.
It really was, and
inspiring.
So, but the message is still loud and clear from the public, is that that the healthcare system still needs some fixing. Frankly, as I used to tell the town halls back in 2009 and 10, when we had everybody out there, upset about all the myths that surrounded the passage of the bill, is that our children and grandchildren will debate healthcare. I mean, it's a dynamic human activity. There's things that will exist in healthcare, 5 years, 10 years from now that, we had no idea, could be possible. And the healthcare system has to adapt to that in terms of, how it provides access to people for, life-saving care. There's some good ideas out there about ways to improve the system, but, unfortunately, as your opening comment said, the majority party is still stuck in terms of trying to roll back coverage for millions of Americans, and it's just, really the absolute opposite direction we should be headed in.
Yeah, I remember that, healthcare is really important, and you have always been a champion. So I want to thank you for that. I think you even didn't take the coverage you deserved from Congress until we got healthcare reform.
That's right.
That was not just symbolism. That was important, I think. But it seemed like the Republicans had kind of given up on repeal and not replace, whatever they wanted to call it, for now. But here it is back again with the tax scam. So what's happening with that in Congress, and how do you think that's going to go?
Sure. So, the Plan B, or the next step in the Trump agenda, was to pass quote unquote tax reform, but I think when I think economists and policy experts think about tax reform, they think about making adjustments to the tax code that really are about fixing outdated loopholes, creating more efficiencies in the economy, and doing it in a deficit neutral fashion. What we're getting instead is just these huge sweeping tax cuts for the top 1%. I mean, repealing the estate tax, for example, will only affect the top 0.2% of the American public, and they're doing it in a way that's not deficit neutral. They're creating huge deficits in the future, and there really is no benefit that anyone has really identified that that deficit spending is going to really create for the economy. In terms of healthcare, in the Senate bill, they roll back the Affordable Care Act's mandate for coverage of insurance, which again is something that some people sort of bridle at. But the fact of the matter is that as the American College of Actuaries just sent a letter to Congress just a couple days ago, that what the mandate does is it spreads risk by including healthy and people in poor health into the risk pools.
This was a Republican idea initially.
It was straight from the Heritage Foundation back in the 1990s. And as you point out, I've been doing this, in the 90s I was chairman of the Public Health Committee at Hartford. I remember the Heritage Foundation talking about an employer mandate, and John Chafee from Rhode Island, who was the Republican senator, and Bob Dole were the chief sponsors of that. But, in any case, the Congressional Budget Office has looked at the impact of repealing the mandate, and they've concluded that 13 million Americans would lose their coverage. And more than that, the actuaries have told us that it will destabilize the individual market and not just affect people who get enrolled through the exchanges, but also
it ripples through
through people who are outside of the exchange. And the insurance industry stepped forward in opposition to it. I mean, again, the AMA, all the stakeholders in healthcare have come out and said, this is totally negative in terms of the impact that it's going to create. There are ways that we should try and find more affordable options for people who are unhappy with the way the exchanges have worked out. And there's some good bills, as I said, that are out there that we know will actually do that. And unfortunately, though, at this point, it's all about just sort of, just bringing this thing down, destroying, the structure of the Affordable Care Act, and obviously giving the benefits of that to the top 1%, which is does nothing for healthcare, and certainly, in my opinion, does nothing for economic growth in the country.
Yeah. As I understand it, there are potential cuts to Medicare and Medicaid because of the deficit that this is going to create. When do you think that might start to happen?
Well, actually, so there's two.
Because it's automatic.
Correct. There's an immediate impact to Medicare in particular that will take place in 2018 if this thing passes, and then there's a long-term, I think, sort of process that's going to get set in motion if this passes, because it's going to create such massive deficits down the road that they're going to have to go even deeper than those immediate cuts in 2018. So the Congressional Budget Office, really about 24 hours before the House vote took place a couple weeks ago, finally issued its first analysis. Again, this thing's been rushed so fast that the Budget Office really hasn't even had a chance to
no hearings and no
it's just outrageous. And it's really not allowing CBO to weigh in is just totally irresponsible.
Budget Office.
Right. So yes. So in any case, what they calculated is that because there are some automatic sort of sequestration and pay-go mechanisms that are built into the law, that if a deficit goes up too precipitously, that it will trigger cuts in Medicare. So it's $25 billion in 2018, which is real money. I mean, you can do a lot with $25 billion in the Medicare system. Correct, and that's going to be a recurring cut. And that's still with a $1.5 trillion deficit baked into the bill. So as many people have correctly pointed out,
to the deficit.
Correct. And what that's going to do is it's going to, the inevitable hue and cry that will be created in the aftermath was, well, we can't afford Medicare anymore because of these huge deficits, and now we got to go in and do, raising the Medicare age, or privatizing the system. I mean, these are the programs that have been on the shelf for the Republican Party in terms of their
long-term desire.
That's right.
Yeah. supposedly right now the majority of the voters actually support the Affordable Care Act now that's under siege. But as you were mentioning, it does need tweaking, and you talk a little bit more specifically maybe about things that could be done to fix the current bill.
Sure.
And talk a little bit about your Medicare buy-in program.
Right.
Which is
So if you look at, the Affordable Care Act, I mean, one thing it did is it reduced the spread of age rating that was in the healthcare system before passage. So in other words, a 23-year-old versus a 63-year-old, there could be as much as 7-to-1 disparity in terms of pricing in the individual market. The Affordable Care Act shrunk that disparity to 3-to-1, okay, which some people wanted it to go to 1-to-1, which is called community rating, which is what exists in the Medicare program. But a lot of people felt that that would just make affordability too much for younger people, and it was a compromise. But 3-to-1 is still a lot. So if you're 50 years old and you're shopping in the exchange, and you turn 50 or 52 or whatever, you're going to have a premium that is for many people a real challenge in terms of paying for because of that 3-to-1 age rating that's there. So and if you look at our mail that we've gotten from our constituents, I mean, there's no question that self-employed people in their 50s, people in small businesses, they're the ones like, I can't believe what Connecticut is going to charge, or Blue Cross is going to charge. So the one, I think, really smart solution to this is to allow people to buy into Medicare once they turn 50. As you know, it's age 65 is when you qualify for Medicare. This is basically saying people should be able to buy into it from 50 to 65. Again, it would be a little different than people who are elderly seniors who are in Medicare, because there would be no public subsidy for people 50 and up unless they qualified for an Obamacare tax credit. But even if you didn't, we've run the numbers with Kaiser Family, which is about as credible, a healthcare analyst that's out there right now, and it would still be a 40% savings for people if they bought just the full premium of Medicare versus what they can get for like a silver plan or a gold plan in the exchange. And it would not be mandated. It would be an optional choice by them. I think Medicare is very attractive.
These might be healthier people than the normal Medicare,
which would help the system.
Group.
I mean, and actually, actuarially, that's right. And frankly, I think we could do some other things as part of our bill, which is HR 3748, which is the Medicare Buy-in and Healthcare Stabilization Act. And there's about 50 co-sponsors in the House. But also it would give Medicare the authority to negotiate better prices for prescription drugs, medical equipment. I mean, frankly, there's efficiencies that Medicare could really accomplish that would, I think, strengthen the finances of that program. And as you point out, getting younger and healthier people into the pool also, I think, will. Kaiser was not willing to go out on a limb too much in terms of trying to, put a number in terms of, the getting a younger population in there. But I mean, common sense tells you, people in their 50s just don't utilize the system to the same degree. So, this is a proposal which does not add to the deficit. I would argue that it, in fact, probably reduces the deficit by creating more efficiencies in the Medicare system. And it fixes a question of affordability, which I think is a real one that's out there. And it really should be kind of an easy, in my opinion, vote for the House to take up. As I said, we've gotten a nice response from co-sponsors. I mean, there are other bills that are out there. Senator Sanders has the single-payer proposal, which would basically convert the entire system in a 4-year span. I frankly think that's a little a lot to swallow and for the whole country to do.
I do think we should be heading that way myself.
I think the Medicare buy-in, frankly, is many people interpret it that way. So, I think that we've had such, sort of difficult, almost trauma, getting the ACA passed, getting it implemented, to have a conversion within a 4-year period to an entirely, single source of payment. I think, it's hard for me to visualize that sort of happening in that quick a time frame. But as you point out, we should build on the ACA and find more efficiencies using the Medicare program, which really is, it's the most popular healthcare program in America, and it's accepted by providers, doctors, hospitals, and it runs very efficiently. It has very low overhead compared to private health insurance.
To me, it seems like an excellent idea, and certainly a good direction to head. But Republicans basically want to eliminate Medicare and Medicaid, which we mentioned before. Do you think that can happen?
I mean, really, I think we need to change control of the House and Senate to really make it happen. Unfortunately, I mean, when you ask them about Medicare, they all kind of, say, genuflect and cross, say how much they love Medicare. But as I said, their tax plan already takes big bites out of the program, and Paul Ryan, is the godfather of privatization. I mean, that's really where he wants to push the system, which would be a disaster for people in their 70s and 80s to have to start, going out there and shopping in the health insurance marketplace. Medicare is simple. I mean, that's the one, real
Most people
attraction.
understand it.
No, absolutely.
Most people are looking forward to it.
Some buy the Medicare Advantage programs, but even there, you have very strict rules about making sure that coverages are guaranteed in it, which is not the case in the private market.
Right. Yeah. We are using Medicare, so we know how well it works and appreciate it.
You paid into it, you earned it.
Yeah.
So I mean, that's a good thing.
Finally got old enough to take advantage. So who hates Obamacare? I know you know something about this because I attended, I think, one of your Montville discussions where it was almost like a fight. And I give you credit because you kept answering some of the same questions over and over, and eventually the crowd did calm down. But we actually heard people saying, keep the government out of my Medicare.
Right.
I heard someone say that in one of the questions. But who do you think really hates Obamacare and why? And can their gripes be addressed? Because, I mean, we sort of have to address some of the gripes. Some of them are just ridiculous. But
So, I mean, obviously, as you've watched the polls shift, I mean, there really, I think, has been a pretty encouraging level of awareness from people that, we're 7 years into the law and about 4 years into the the program in terms of actual enrollment and Medicaid expansion, that people are sort of now running into other folks, if not themselves, who've benefited from the law, the age 26 coverage. So there really, I think, has been, a real impressive shift that's starting to happen out there. A lot of this stuff was complete fear-mongering for totally political purposes, and this was never about...
the Obamacare and the Affordable Care Act have sort of melded together. Because people hated Obamacare, they liked the Affordable Care Act, and now they're starting to realize they're the same thing.
No, that's right. I mean,
I think it's a marketing question from the beginning. It wasn't marketed as well as it could have been.
And as I said, watching this process unfold in 2017, where Paul Ryan predicted we're going to repeal this within the first month. This was back in January, and Trump, made the same kind of promise, and they would just watch this thing slowly. Leak and get to the point where
they seem to only be in touch with the haters, the people that really hate it, and really hate it. So it's like they don't know that there are people that really like it.
And there was really no serious stakeholder, that was really out there, whether it was the payer community, provider community, the patient community. I mean, there was nobody that was supporting this effort. So. As I said, I mean, Medicare, when it was first passed in 1965, covered doctor's visits and hospitalization, period. Today it covers medical equipment, it covers, dialysis treatment. Now it covers at least partially prescription drugs. Laws evolve and programs evolve over time. And that's what really should happen here with the Affordable Care Act.
We hope our government will work together for us, but it's not exactly what's happening.
Yeah. Well, again, I still think that people should feel pretty good about the fact that this repeal effort, collapsed at the end of the day, and it was really because of the public external effort. Again, I encourage your listeners to email my office, Chris Murphy's office, Dick Blumenthal's office. Same thing with the tax bill, by the way. We had 1,800 communications in the very short period of time that the tax bill was unveiled and voted on, and really impressive stories people told about the medical expense deduction, which the tax bill is eliminating. Unbelievable.
Historic renovation is getting
right. That's right. The historic tax credit, the
education,
state and local tax, and
people. We're going to get to that.
And people ran, but I was just going to say the communications matter. Sometimes people are like, I think I know how you're going to vote. I'm not going to buy it. People should at least pop an email, and the same is true for the two senators.
Another big issue on healthcare is the cost of drugs, and I want to hear what you've got, any ideas you've got on how we can reduce the cost of drugs. It's a huge part of it.
No, there's no question. If you look at public opinion, that really is the number one health concern that people have. So, I mean, obviously, we can begin with the government as a customer, which we have direct control of. Medicare provides coverage for roughly about 60 million Americans. Medicaid covers about 70 million. I mean, it's quite amazing when you see the total numbers of those two programs. You know, you throw in the VA and children's health insurance. It's a substantial part of the American public. That's a lot of bargaining power, and the government should really do a much better job in terms of you know, bidding out services, and obviously the pharmaceutical industry's pushed back against that. As you recall, when the Medicare bill, prescription drug bill, was passed by the Republicans, there's actually a provision in law that prohibits the government from negotiating better prices in Medicare, which is
It's ridiculous.
it's a total giveaway. And you know, the VA, which does have negotiating authority, does a far better job in terms of providing affordable coverage. So we certainly should start there. And secondly, I think we've got to look at you know, some of the so right now there's an incredible drug, Sovaldi, which provides really almost a miracle cure for people with hepatitis C, which is a very, you know, deadly illness, you know, that causes liver damage, but the treatment costs $85,000. It's about $1,000 a pop because it takes about 8 treatments. The amazing thing is it really works, you know, in a way that interferon, which was the treatment before, which was you know, you had to go in every few weeks or so, and it was, you know, it was perpetual. This Sovaldi, you know, you get 8 treatments and it's gone. I mean, and you can be really actually pretty far into the illness and it still works. But a lot of Medicaid programs, because there's a lot of people with hepatitis C who are on Medicaid, because frankly it affects people who have had substance abuse problems, you know, dirty needles, you know, blood transfusions, et cetera. For Medicaid to absorb that kind of cost, which is this, you know, the program for low-income Americans, is really hard for states. And you know, I think that the people who researched and developed Sovaldi, I mean, really are amazing. You know, it's almost like a miracle drug. But frankly, there's got to be a fairer way to spread the cost and avoid really creating barriers to people, because that's what's happening right now. Medicaid is really restricting access to Sovaldi to you know, only people with early stage hepatitis C, even though we know that it will cure people even with later stages. And so, you know, for Medicaid, they have what's called a rebate program where the manufacturer offers a drug at, you know, a price, let's say $100, and the state of Connecticut gets an 11% rebate off of that, which back when that was first passed, and I was in the legislature when that first passed, that was actually seen as a pretty good move to save money for the taxpayer. But now what they're doing is they're building in the cost of the rebate into the marketing, you know, the fair market price. And we've got to really strengthen the government's ability to negotiate better prices. And the good news for our healthcare system is if you cure people of hepatitis C, I mean, you're taking other costs out of the system that frankly are, you know, that dwarf, you know, the hit that, you know, society will take in terms of giving people access to that. So again, it's, you know, it's an issue that it's ultimately a political one, because, you know, the pharmaceutical industry, and, you know, we obviously have a big employer here in the region who do great things, and we should help them with, you know, R&D tax credits, which I support, you know, as a way of promoting good research so that we find drugs like Sovaldi. But frankly, building into the pricing mechanism these kinds of huge inequities, you know, it's really not the right way to you know, create access to life-saving treatments.
And the costs are low in other countries.
Right. No, and that's the thing. They've obviously figured out a better way.
So there's a way to do it.
Yeah.
You already mentioned what constituents should be doing. They should be contacting you and staying knowledgeable. I'd like to go on to a bonus question here. We're running out of time, but talk a little bit about the tax scam, as I'm calling it. I think Nancy Pelosi was calling it that too. It's about to be voted on in the Senate. You've already had your shot, but do you have a list of the greatest hits, as I call them, that the average American can expect from this? Because I know there are a lot of issues that people have no clue are coming, and if this passes, it's going to be
I mean, you know, traditionally in the tax code, if you have medical expenses that exceed 10% of your adjusted gross income, you're able to deduct that on your tax filings. I was with a woman from Old Saybrook the other day whose husband has Alzheimer's, which is, you know, it's just a, you know, an incurable condition, unfortunately, at this point.
My mom had Alzheimer's.
So she is helping her husband with institutional care. which costs well over $100,000 a year in terms of a long-term care facility that has an Alzheimer's specialty. And she lost the ability to deduct that off of her taxes, which in the House bill, which, when you think about the fact there's about 120,000 people in Connecticut that claim that itemized deduction. We know that from sort of global IRS data. These are people who are struggling with, incredibly, horrible chronic conditions, whether it's for themselves or their loved one or their kids or whatever, and to take away that deduction. And these are people who are paying their bills. I mean, that's the thing, is that these aren't freeloaders or, people are gaming the system. These are people who are actually paying for health care, and they're losing that ability to deduct it. So, whether it's student interest rate payments we're losing the deduction on that, the tuition waiver for graduate students, they now will have to pay income tax on the value of tuition at UConn or, some school where they're a research graduate student. I mean, unbelievable. There's some real uglies that are in this bill.
I think apprentice and education.
That's right. Teachers were allowed to deduct up to $250 for school supplies.
Now they can't deduct
right. So it's and for what? I mean, to make sure that people with estates,
people who've got it more.
That's right. I mean, the estate tax right now, for an individual, if the first $5.5 million of your estate is exempt today, and there's a COLA that's been built into that, but this wants to eliminate it entirely. I mean, we know who. I mean, it's Paris Hilton and the super rich. They're the only people in that strata, and that costs the federal government roughly
they avoid taxes throughout their life, and then they avoid taxes at the end when they could actually pay a little debt to society.
Yeah. So it's
pretty tough.
It's a real test of really, not just people's party politics, but really just what kind of people they are to vote for something like this.
We are getting near the end, but I got a couple of choices for you here. I wanted to ask a little bit about climate change and maybe about infrastructure and net neutrality.
Right.
Three big issues we could spend an hour and a half on each. Go ahead and talk about those three if you'd like.
I mean, first, President Trump took us out of the Paris climate change, and I think Syria actually now signed on to it. So I think we're just about the only country in the world.
Nicaragua, where somebody was
that's
out
right.
because
But
they
I think
wanted it stronger.
That's right. That's correct. Yeah.
I think that was it.
And we should be the leader, not the outsider, in terms of really the first global effort to deal with carbon emissions. Again, if you look at other efforts in the past under Republican presidents, were chlorofluorocarbons, the stuff that was in aerosol cans. We had an international treaty, and the world came together and actually solved that problem. And it was burning holes in the ozone layer. So the notion that this is somehow sacrificing sovereignty is garbage. There's clear historical precedent.
We're actually giving the benefit to the Chinese because they're going to develop alternatives and be the
Totally.
leader. And there we are watching them run with it.
So that was number one. And then number two, he rolled back the Clean Power Plant rule, which was a very, I think, very balanced proposal that Gina McCarthy, who used to be the DEEP commissioner in Connecticut, worked out at EPA. And
that had direct consequences for Connecticut because power plants in the Midwest and West are sending
junk
their
is going to come
pollution
our
here.
way. And
so
it's really, really in the ranking of, what this administration is doing, it is right there at the top of the list in terms of really harmful policies that are happening. As far as infrastructure, again, lots of promises on the campaign trail, zero in terms of anything in his budget, in this tax plan, that are going to do anything to deal with, aging infrastructure. Outrageous because and I know a lot of blue collar workers out there. They heard that infrastructure promise, and that was one of the driving forces.
And that was
in their
something
vote.
Democrats would have joined in on, no problem.
Absolutely.
And we would have had a bipartisan thing to start off with. It should have been the first thing they addressed.
And net neutrality. Lastly, again, a lot of some of your audience have contacted my office. We've had a huge uptick, and it should, because it's going to create a two-tiered internet where normal service is going to be more expensive, and it's going to be the poor, cousins who are getting regular internet. And as you and I were talking off camera, small businesses now, they thrive on internet advertising, which is a really great, efficient way to get the word out. This is a cost on small businesses because either they take the crummy version and they're going to lose marketing, or whether or not they're going to have to dig into their pockets and pay more. For whom? Again, it's the big telecommunications companies, the only ones who will benefit from it.
Thank you for squeezing a
Okay.
lot in.
Yeah,
sorry,
sure.
sorry to rush you, but all these issues are really important. I'm glad you're willing to talk to us about them.
No,
And
we'll
like
come back and,
I said I'd like to have you come back
Sure.
and we'll pick another topic and thrash that around because I know you're knowledgeable and we out here like to hear what's going on.
Good. Thank you, Peter.
Thank you very much for working hard for our district, representing the 2nd Congressional District. And especially thank you for updating on these issues. It's really important and I appreciate it.
No.
Thank you all for watching Potluck Politics. I'm Peter Roper. I urge you to find out what's going on, get involved, and be well.